What I Have Learned by Brienna B. I can honestly say that I have learned a lot throughout this course this semester. A lot of the information that we have learned I was aware about but was not informed about. I have gained a lot of knowledge that will help me throughout my life and future career as a healthcare administrator. Long-term care is something that we all need to be aware about, whether it's working as a healthcare professional or deciding where to place a loved one in their later years of life. I think that a lot of people may be confused between the difference between nursing homes and assisted living. I found it interesting to learn about each. Here are some common differences between the two. Nursing homes are a step down from hospitals. Rooms are typically smaller than dorm rooms, and the monthly costs are typically between $6,000 to $7,000 a month, and they provide 24/7 care. Assisted living runs for about $3,000 to $4,500 a month, plus additional prices that may be added depending on the situation of the resident and their needs. Usually, apartment-style living is seen, and it's more of a social community. Staff members usually stop by once a day. Because we may encounter long-term care facilities in the future, we have to realize that although there are many services offered, the environment of the facility is important so we can make sure residents are safe and comfortable. There needs to be windows with natural light, an intimate setting rather than a hospital setting so residents feel more comfortable. No flooring with crazy designs. This can lead to confusion. There needs to be more color contrast and simplistic flooring so there is more visual acuity. Doors and windows should not be readily operable by the elderly. Financing medical services is something that the elderly face as the health conditions and medical care increases. In previous classes, we had touched on both Medicare and Medicaid. Up until this course, I hadn't really realized how much there is to know about the two and how important both are in the healthcare field. I will now highlight a few main points that I found most interesting when learning about Medicare and Medicaid. Medicare is available for those who are 65 years and older, regardless of income. Users of the services pay premiums, deductibles, and co-payments. Medicare finances skilled nursing home care, but it imposes many restrictions. It does not pay for full-time nursing care. It covers a maximum of 8 hours daily and a maximum of 28 hours per week. It does not cover assisting in daily activities, and it finances limited stay in skilled nursing homes for rehabilitation, but if the condition stabilizes, then coverage stops. As for Medicaid, Medicaid provides services to the disabled, blind, and poor of all ages. It is the last resort for the elderly, and they must prove that they have few or no assets. It pays for unlimited nursing home care and does not require previous hospitalizations. It also covers the expenses for former middle-income elders who have depleted their finances by paying for nursing home costs. I've learned about advanced directives in a philosophy class that I took, but we had only briefly discussed the topic. I really thought it was interesting that there are different types. A living will is an outline that specifies medical treatments to be withheld or withdrawn depending on the situation, and power of attorney specified to a family member or friend to assist in medical decision-making for the patient who is no longer competent. I always knew that the elderly may be prescribed many prescriptions and medications, but I did not realize that taking multiple medications may cause adverse drug reactions such as confusion, falling, renal dysfunction, poor vision, hearing loss, and memory loss. For healthcare professionals, taking a careful drug history and prescribing only small doses at first of the medication can help reduce reactions that may happen. The most important question is, how will this help me in my future? I always knew that I wanted to work in healthcare. I have recently taken a position as a patient access representative with Ministry St. Clair's Hospital in Weston. I do a lot with insurance verification and registering patients. Although I have just begun in my career, I already can use the information I've learned in this class and apply it to my job position. Each day I am working with Medicare and Medicaid and different types of health insurance. Knowing more about these topics has allowed me to transition better into this position. I am also more educated in advanced directives. We are directed to ask each patient if they have an advanced directive on file at our hospital. As I further my career in healthcare administration, I know a lot of these topics will help me. The most important thing that I have learned that will also help me in my future is the importance of taking care of oneself. Many young people don't realize that the decisions that they make now will make an impression later in life. It's important to live a happy and healthy life. Remain active, eat right, make healthy choices and decisions, live well, and live each day to the fullest. And more importantly, follow your dreams. And as a last note, happy aging.